Thank you. 8:44. It is one of the first things we learn at a young age, how to wash our hands. It is so important in keeping ourselves healthy, and especially those around us, too. It is Hand Washing Awareness Week. There is such a thing. And joining us now is Dr. Shady Salib. He is the Chief of Staff for Palm Beach Gardens Medical Center. Thank you so much for joining us today.
You're welcome, Jonathan.
All right, so let's talk about, like the proper way. What is the correct way to wash our hands?
Right, so there are two sets of rules that we're going to mention today. Number one, the 5 principles of hand washing. Wet, lather, scrub, rinse, and dry. We have to make sure that we dry our hands with dry towels and make sure we dispose them the right way.
Okay.
And turn off the water using the towel, not your hand.
Good, right, or else you have to start over again. All right, now what about, some of those machines in public restrooms?
Yes, hand drying is also very appropriate. Yes, we can use that.
But I've also heard that those spread the germs because of the force of the air.
No, not necessarily, because the air is very hot, so it will kill the germs. The second set of rules we're going to talk about is hand awareness rules. You have to wash your hands before you eat, wash your hands after using the bathroom. Don't cough in your hands, don't sneeze in your hands, use your sleeves instead. And wash your hands for 20 to 30 seconds.
All right, and if you play with a dog, also wash your hands.
Wash your hands, I agree.
That's always a good one. All right, what about hand sanitizers? Is that as good as washing your hands?
So hand sanitizer will kill almost 99% of the germs. We have to make sure that they are 60% alcohol concentration or more. Some bugs will not be killed by hand sanitizers, like norovirus that can cause stomach illnesses, and C. diff that can cause diarrhea. That is life-threatening. These are going to be killed more by hand washing, which is more superior to hand sanitizer. Anything you can get your hands in, whether it's hand washing with soap and water and hand sanitizer, will be accepted.
I'm sure as a doctor, it just became such a habit for you to wash your hands. You have to wash them all the time.
I have to wash my hands after seeing every patient. Absolutely.
All right, so hot or cold water, does that make a difference?
Hot water is more appropriate for killing germs, but if you don't have access to hot water, any running water with soap is fine.
All right. Is warm water good too?
Warm water
will work. All right. What diseases does hand washing with soap help prevent?
So the most common illnesses are the flu and common colds, which can knock you out for 3 to 4 days. There are serious illnesses like diarrheal illnesses that can be life-threatening for the old and the very young under 5 years, and pneumonia. Pneumonia is very serious.
And lastly, antibacterial soap or regular old soap?
Regular old soap is superior to hand antibacterial.
Good deal. Good to know. All right. Thank you for joining us. All right. Enjoy the holidays. Thank you.